Opening statement.
It's a shame that the conversation about threats to Medicaid continues. These are dark times in our country. So let's be clear about what today's markup is and isn't about. This isn't about reducing fraud, waste, or abuse. None of us want fraud, waste, or abuse. Yet this is about ripping health care away from working families, children, seniors, people with disabilities, veterans, and pregnant women. Yet my Republican colleagues dismiss, and I would say even laugh, because I've seen it today, over our concerns over $800 billion in Medicaid cuts as a misunderstanding. Just targeting waste, fraud, and abuse. But you don't just gut the largest insurer of low-income Americans without real harm. Call it what it is: abandonment, disinvestment, and pure disregard for human life. Let me share with you one of my faces of Medicaid. La Rabida, a hospital in my district, takes care of kids with complex chronic medical conditions. 90% of their patients are covered by Medicaid. One of those kids is Cairo. When Cairo was 2 years old, his mother found him nearly unresponsive at daycare. After rushing him to the hospital, they found bleeding in his brain. He needed a breathing tube, a tube for feeding, and a shunt to drain fluid from his brain. He was extremely sick. They discovered he had a genetic condition that leads to abnormal blood vessel connections. After spending a month and a half in the pediatric intensive care unit, his medical expenses reached $2.5 million. As a mother and grandmother myself, let me tell you, a parent will pay any cost to save their child. But as the richest country in the world, no loving parent should experience crippling medical debt to treat their child. Both of his parents worked full-time to support their family of 5, but because Cairo was under 6 years old when his genetic condition was discovered, he and his siblings could stay on Medicaid. With Medicaid, he receives 24-hour care, including in-home nursing, which allows his parents to continue working full-time. His mom said that if it were not for Medicaid, he would not be here today. When he arrived at La Rabida, he was on a ventilator support, had little mobility, and could not speak. Now he is completely off the ventilator and can walk. Medicaid is a lifeline for him, for his families, and for millions of Americans across this country. In my district alone, over 300,000 of my constituents would be at risk of losing their health care, more than any other district in Illinois. In Illinois, 3.4 million people are covered by Medicaid. When Illinois implemented Medicaid expansion, the uninsured rate dropped by 44% between 2013 and 2015. These demonstrate the significance of Medicaid for Illinoisans. These are not just numbers. These are real people that will suffer. Thank you.
The gentlelady yields back, and is there any Republican side? Seeing none, the gentlelady from California is recognized for 3 minutes for an opening statement.
Thank you, Mr. Chairman. Under the cover of night, House Republicans proposed the largest Medicaid cuts in history, all to pay for tax breaks for billionaires. They hope the American people won't notice until it's too late. And today in this hearing, we should be starting with talking about Medicaid and the health care. For months, Republicans told the American people that their budget would not cut Medicaid. That is not true. And today they continue to say it. Don't believe it. For months, Republicans hid the truth from their constituents and refused to do town halls. If you will not stand up, if Republicans will not stand up, Democrats will. Today we are joined by Sasha. Sasha, please stand. Sasha is a constituent who came from New Jersey's 7th District, represented by Congressman Tom Kean. She was born with cerebral palsy, and the right side of her body doesn't function due to a stroke she had